Welcome to this module. My name is Stanley McCallon. Today we're going to be discussing non-invasive methods for assessing lower extremity vascularity. Developing a strategy for evaluating patients at the bedside is a critical first step for healthcare providers. Our focus today is on the non-invasive assessment of the arterial supply to the lower extremity. We will not discuss the assessment of the venous system. However, it is very critical for the provider to assess the arterial perfusion before initiating compression or any therapy intervention to assist the venous system. Many patients may present with mixed disease affecting the arterial and venous systems. We will also review several methods which will allow the clinician to perform a global assessment of the vasculature and determine if more invasive testing is indicated. According to the National Institute of Health, more than 10 million have been diagnosed with peripheral arterial disease in the United States. There are likely millions more who are undiagnosed. It is essential that a thorough, and by thorough I do not necessarily mean time-consuming, but a thorough vascular assessment should precede any therapy interventions. This includes any therapy that involves compression of the lower extremity. Performing a thorough lower extremity vascular exam is considered best practice by many organizations, including the Wound Healing Society, the American College of Cardiology, and the American Heart Association. The examination should be performed on all patients who present with integumentary disorders and those who are at high risk, for example, patients with diabetes and patients who smoke. We will be reviewing the components of a thorough evaluation. Some will only be included if other tests are positive. For example, if a patient has diminished pulses and distal skin changes, the provider can include other tests such as ankle brachial indexing. We will discuss these in more detail on subsequent slides. Skin inspection is a quick and very revealing indicator of vascular competency. Have your patients take off all clothing and shoe wear on both lower extremities, not just the extremity involved. Chronic arterial disease will usually affect both lower extremities, but may be more pronounced on one or the other. Look at the color of the skin, the appearance of the skin, patterns of hair growth. Assess temperature using the back of your hand. If available, one can also use a radiometer to determine skin temperature. Evaluate